Good morning. My name is Amy Sessions Robinson, and in 2013 I was diagnosed with ulcerative colitis. At first my symptoms were fairly mild and were easily controlled with an oral medication. But in the fall of 2019, my symptoms started to worsen, and an oral steroid didn't help. By the end of the year, I was experiencing constant nausea, blood loss, weight loss, and by mid-January, my doctor recommended a monoclonal antibody treatment. Because these treatments are really expensive, he requested pre-approval from my insurance company, and I was told that the approval could take some time, some weeks. When you're losing blood, time isn't really something you have a lot of. And within a couple of weeks, I was admitted to the hospital. I was dehydrated, anemic, and I'd lost about 15 pounds. I was treated with an IV steroid, which had no effect. My doctor requested the insurance expedite the approval of the antibody treatment. It took him another week to approve, and I was in the hospital for about 8 days till I was able to receive that first treatment. Meanwhile, my symptoms continued to get worse. After the first treatment, slowly, things seemed to stabilize, but over the next couple of months, I started to get worse again. I continued to lose weight, had no energy, no appetite, my hair was falling out, and my doctor recommended a different monoclonal antibody. Again, we requested approval from the insurance company, and they denied the approval because they wanted me to try a different monoclonal antibody treatment than the one my doctor recommended. He said that what they were recommending wasn't going to work for me because it worked under the same mechanism as the one that I already tried that had failed. I continued to lose blood. I was receiving iron infusions to stave off anemia. My family thought I was dying. I was put on a feeding tube because I had lost over 20 pounds at that point. I had three options. I could take the ineffective treatment and continue to suffer. I could impoverish my family by paying tens of thousands of dollars out of pocket for the treatment that I needed. Or my doctor offered an option to participate in the study of a new drug and hope that I would not receive the placebo, because you don't know on a drug study, and that the experimental drug would work. I chose to try the drug study and kind of gambled, but I won. Fortunately, I didn't get the placebo. The drug worked, and I've been essentially symptom-free for the past year, but no one should be faced with this kind of choice, especially when it's forced upon them by the bureaucratic policies of an insurance company that's more worried about their profit margins than people's health. My story had a happy ending. I'm healthy right now, but not everyone's does. Thank you.